guys, so it's me, it's Erica. I am back again. This is day 6. So on day 6, which is tonight, we will be talking about medication management for the elderly at home. So if you can just either like, save, share, whatever you want to do, whatever way you can get back to this video, make it happen. Um, so first topic is create a medication list. And with that, you probably already have it. Going to your physician, you'll probably already have it. But if not, just create a list of all the meds that you take. Make sure that the dosages and the times are all on them so they can be taken properly. Next topic will be using a pill organizer. So it's very important to organize your medications. You can set it up weekly, monthly. It just depends. You can order pill organizers from anywhere. And if you don't take a lot of medication, or if your loved one don't take a lot of medication, they can literally get a pill organizer as simple as Dollar Tree. I mean, I don't recommend it because those are cheap, but if you got to do it, you got to do it. But you can go to Walmart, order on Amazon. I think they even got it real fancy where you can order a pill organizer where the pill is kind of spit it out to you, like dispense it. That's what I'm trying to say. It'll dispense it to you at the particular time. So it just depends on what you want to do. But just make sure that the pills are organized according to the label. Set reminders. Everyone has a smartphone nowadays. So set reminders, set timers, set appointments in your phone, however you want to do it in your calendar. But set reminders just to make sure that your loved one is taking their medication on time. And then understanding each medication. I highly recommend just asking a doctor questions, asking a pharmacist questions, or just a simple Google where you can type in acetaminophen or Tylenol or whatever the medication is, and you'll know, oh, this is for pain or this is for blood pressure, whatever the medication is for. But understand your medication so you'll know. Read your labels carefully. That's the next topic. Always read the labels before taking medication to ensure that the correct dosage and timing is on there. I always tell everyone, read it before you take it. Now, if you're going to help your loved one separate the medication into the different little containers, then you should already know what you're setting. And when I say read your labels, just make sure like there's some medications that the label will say take this medication with food, or take it before mealtime, or take it as soon as you finish it, or take it at night. So just make sure you read every label. Or it may even say don't take this medication and drive, so just make sure that you're reading if your loved one is still driving. Next, we will go over keeping the medications in a safe place. Store your medications in cool, dry places, away from children. So if you have children or animals or anything in the home, please make sure your medications are far away from them, and out of their reach. And then read, again, back to reading the labels. Some medications have to be refrigerated. So make sure that you have those stored in the right area. Regularly review your medications. So what that means, review your medication list with your physician or pharmacist to check with like interactions, or make sure you're not taking unnecessary meds, because sometimes when residents come into a facility or into the care home, we'll notice like they're on a lot of medications, and the medications together could be creating something different that shouldn't happen. Again, please, 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 please go over everything with your care provider. Or just, again, go to whatever pharmacy, CVS, Walgreens, whichever pharmacy you use, any pharmacy that you use, that's just a service that they offer. They will talk to you about your medications. Proper disposal. So this is something that most people don't do. But you have to dispose of expired medications and use medication safety. So unused medications, please make sure you dispose of those safely and don't just throw them anywhere. Again, speak with your pharmacist. This is what they do. They don't mind talking to you about it. So please make sure that you're disposing of them. Another topic will be reporting side effects. If you have any side effects with your medications, please call your care provider, call whomever prescribed it, like whatever the situation may be. Report them immediately to your physician. Just in case, some people may take a certain medication and get a rash or hives or just anything. So please report all of that. And last but not least, ask questions. I encourage you, as the family member, caregiver, or your loved one, to ask as many questions as possible about your medications. Like, make sure you ask all the questions you can ask and that you leave with a clearer understanding. Do not leave and just say, I guess, ask all the questions you can ask. That's just like I mean, it's almost common knowledge, but I want to make sure that you know this. If you don't know, please ask all the questions that you can ask so that you don't have to worry about it later. That's all I have for you. Have a good night.